Good evening, everyone. It is Sunday, April 26th, and I am just going to go ahead and give you the day's update and all the statistics that we've got for COVID-19 in Sonoma County. So starting off, we have 5,329 tests completed in Sonoma County. Total cases, 220. Just for a little bit of, kind of situational awareness, 220 total cases is exactly 0.04% of our population. In terms of active cases, we have currently 115 active COVID-19 cases, and that is 0.02% of Sonoma County's population. We have 103 people who have recovered and 2 fatalities still. In terms of the age breakdown, we have 22 confirmed positive in the 0 through 17 age range. In the 18 through 49 age range, we have 112 confirmed cases. In the 50 through 64 age range, we have 51. And in the 65 and older, we have 35. In terms of gender, we're actually getting a little bit closer to 50-50. For a while, we were predominantly female. Right now, we have 104 male and 116 female confirmed cases, so that's sort of narrowing the gap a little bit. Now let's go to our regional breakdown. North County, 21. South County, 32. East County, 17. West County holding steady at 16. And Central County at 134. We are continuing to see more cases in Central Sonoma County, where we do have the highest population density in the county and the majority of folks living there in that Central Sonoma County area. Of those total cases, we're still tracking around 10%-ish with respect to hospitalization rates. So 22 have required hospitalization, 198 have not required hospitalization. In terms of sources, we are continuing that the dominant new sources, sources of new cases are coming from contacts. Now, in a way, this is actually good news. This is because the county is aggressively testing all of the contacts of confirmed positive cases. So whether you are symptomatic or asymptomatic, if we've got one confirmed positive, we are going in and we are testing every single family member. We are testing every single, coworker who has had close, prolonged contact with one of these folks. And so that's why we saw that really large peak actually on Thursday night of a spike in new cases. Those were 22 new cases, and I believe that 18 of them came from that aggressive surveillance of close contacts. So the good news is that we're actually catching some of these people that we otherwise wouldn't know because they were asymptomatic. But we're saying, hey, you know what? If we've got a confirmed positive, chances are that their family members may have the infection as well. And that's where we're able to get more accurate numbers for you. So we actually know what the spread of the disease looks like. So again, going back to the sources, 42 were travel related, 36 community spread, that means an undetermined, sort of unknown source of infection, and then 102 are close contacts and 40 remain under investigation. I want to give you a little breakdown of what the top symptoms in Sonoma County are in terms of COVID-19. So what are those folks self-reporting as what they are experiencing when they test positive? 65% experience a cough, 56% experience fever, 52% experience headache, 46% experience chills, and 45% experience muscle aches. And if you go to socoemergency.org and you click on the dashboard, you can actually see the entire list of every possible experience, what they've been seeing in terms of symptoms with respect to every single person who has tested positive for COVID-19. Sorry, my words got a little away from me. All right, moving on. I want to remind you that we do have a mental health warm line available in Sonoma County. It's open 7 days a week from 10 a.m. to 7 p.m. And to provide you a little bit of a report back on that, on our first day, we actually had 42 calls. So we're really hoping that word continues to get out and people continue to utilize that warm line. As a reminder, it's 565-2652. Again, that's 707-565-2652. Other county news this weekend was the debut of our drive-through testing for healthcare workers. And as a reminder, healthcare workers not only includes nurses and physicians assistants, but also housekeeping and janitorial staff, as well as security. So anyone who is going to come into contact either with patients or with the surfaces that patients have been around. So it's open to everyone, and the phone number for that one is 565-4667. By appointment only. And when I say everyone, I want to have that asterisk that this is for healthcare workers only, but any kind of healthcare worker, including janitorial staff and housekeeping and security. Finally, I recognize that it was a challenging weekend for a lot of people who live in the lower Russian River and the coast. And that there was a constant stream of traffic on Highway 1. And I also heard a lot of river use from out of town and out of area people. I want to remind you that if you do see violations of the shelter in place order, please report that to the sheriff's non-emergency line if it's in unincorporated Sonoma County, and that phone number is 565-2121. Now, if they're inside city limits, then you report that shelter-in-place violation to the city police department. But if it's unincorporated, so if it's on the coast or the river, you would report that to the sheriff's department, and they will go out. I know that it's been sheriffs, it's been regional parks, it's been state parks, and it's been CHP. They've been working all weekend long to try to address these violations. And unfortunately, we're continuing to see primarily out-of-county people coming in and trying to utilize the beaches. In some cases, even moving signs and cones and just driving into parking lots anyway. So we're going to keep working on that and see what we can do to address those concerns. I know it produces a lot of anxiety in the locals who live there and are just seeing tons of people flock into their communities. All right, a couple of other exciting updates. On a positive news, on Tuesday, the Board of Supervisors will vote on the 5th District Tourism Impact Fund grants. We spent a lot of time analyzing phenomenal proposals that the community put together. We only had about a $250,000. We easily could have funded twice that much because we had so many wonderful proposals. But just to give you a little bit of a sneak preview of what you can expect being deployed in the weeks to come, we want to get this money out the door as quickly as we possibly can to help as many people as we possibly can get through this pandemic. We are prioritizing workers, small businesses, undocumented members of our community, youth and family who are in need of food or other sort of resources, those who are at risk of homeless, as well as those who are homeless, housebound seniors, artists, and then also some work on mental health and wellness. So some of those projects that we're funding include opportunities to purchase food from restaurants and get them to housebound seniors. In some cases, just buying gift certificates to local restaurants and then selling them at a dramatically reduced rate to locals, so that locals who can afford to buy food but maybe can't afford to buy restaurant level food can actually go out and support that local small business. So we've got a number of really exciting proposals, and I hope that you all can check out the Board of Supervisors agenda and see what we funded. All right. Oh yes, and the last big update is that on the Board of Supervisors agenda on Tuesday, we will learn about the revisions to the shelter-in-place order. So we're going to see 2 new orders rolling out this week. One pertains to parks, and one pertains to a revision of the shelter-in-place order. And so there will be more information forthcoming on Tuesday, but you can expect to see some openings in the shelter-in-place order just to bring it more in alignment with the state order. So we'll have some increased opportunities for people who are in construction. That's kind of the main one with respect to business. And then with respect to the parks, you are going to see an opportunity to utilize your neighborhood park. So not just yet. I know we're all itching to get outside and to go utilize our neighborhood parks, but stay tuned for more information on Tuesday regarding the parks order changing. There are going to be, it's not just sort of any park. You're not going to be able to use playground equipment or other sort of high touch surfaces, but we do want people to be able to walk or bike to the park that is closest to them. So with that note, I will turn over to the questions, and my husband got here just in the nick of time from putting our son to bed. So I will look over and see what the first question is.
Is there a way to find out if we have already had it?
Is there a way to find out if you've already had it? That is a great question. We do have antibody testing on order in Sonoma County. We do not have a confirmed delivery date yet, but we want to know whether you have had it just as much as you want to know whether you have had it, because we really want to track, what is the likely extent of the virus in Sonoma County. So we did place our order for that, and we're just waiting to hear back when that will occur. I've heard casually from some other members of the community who are able to get testing. I'm not sure exactly how, but not through the county public health lab, that they actually have been able to obtain antibody testing. And I'm not sure how they got that done, because I don't know that we have it widely commercially available in Sonoma County yet. We do not yet have it in the public health lab.
Does the county have enough contact tracers?
Great question. Does the county have enough contact tracers? We do. We have actually really stepped up, and there are about sort of 60 people total on the public health team. We just got more than 10 new public health nurses trained and ready to do that contact investigation. And to give you a little bit of a sense of what goes into contact investigation, it's not just kind of picking up the phone once and dialing a number and you don't get through to someone and so you hang up and you call it a day, right? These people are basically turning it into sleuths, right? They are trying to track down every person that came into close contact with the confirmed positive patient. And then they're actually trying to get them tested. So not just calling them and letting them know to sort of, maybe they should stay home, they came into contact with a confirmed positive. No. This is, you're going to get a test. You are going to be sort of quarantining and self-isolating at home. And then we are going to keep calling you to check in on you to see what your symptoms are. So there is actually aggressive monitoring that's happening with the close contact investigation. And I think that it's going to be one of the most critical tools in our toolbox to really being able to get our arms around this virus in Sonoma County, and hopefully to be able to start to return to not exactly normal, but some sort of semblance of social and economic functioning here in the county. Next question.
When will Sonoma County reach its apex? When was California apex?
This is a great question. When will Sonoma County reach its apex, and when will California reach its apex? And I'm actually going to just say I don't know, because we are anticipating getting brand new modeling data this week for Sonoma County that will reflect the successful efforts of our community to shelter in place. As I said last time, our Dr. Mace, our public health officer, believes that all of your efforts of staying home and only going out for essential services has actually really just completely flattened that curve in Sonoma County and potentially even brought the transmission factor below 1, which is a really, really big step. So I think that actually we have exceeded our modelers' expectations. So, our trajectory actually wasn't as bad as our modeler thought it would be. And so they are utilizing all of the data that we have, real-time data every day, the number of positives, the number of recovered people, what the transmission sources are of the disease. And we are expecting to get better and improved modeling data based on what's been going on in Sonoma County this week. So stay tuned, and I will hopefully be able to discuss that modeling data with you on Thursday.
A couple of people mentioned, just to let you know, about some San Francisco planned event to bring a mass amount of people to town in June to the Lower Russian River. They have a website.
Okay, I just heard that my husband was sharing that there is some plan for someone to bring a massive number of San Franciscans into the Lower Russian River in June. So I will definitely be looking into that and trying to advise these folks that would be against the shelter in place order. And again, so we have our local shelter in place order, right? Our new revised version of the shelter in place order is going to more closely align with the states, but it's important to remember that the state's shelter in place order does not have an end date. And one other thing that I want you to know about the new shelter in place order is that it does have some guidelines regarding events and whether or not that's okay. And no big news flash here. It is not going to be a summer where you can have large scale gatherings like that, whether it's in the Lower Russian River, whether it's in Santa Rosa, whether it's anywhere in Sonoma County. So we are anticipating a prohibition on large gatherings for the duration of the summer, because things like, unfortunately, the things that we love in our community, right? Parades, fireworks, opportunities to all come together and celebrate as one. That is one of the worst things we could do right now with respect to public health. Those kinds of situations are obviously prime opportunities for COVID-19 to spread. And so we do not expect large-scale events to be happening this summer.
Someone asked me if you know anything about when they will get testing results in Bolinas.
Oh, yeah, that's interesting. Someone asked if I knew when they will get testing results from Bolinas, which is a really interesting sort of piece of news, that the entire town of Bolinas is actually going to get tested for COVID-19. And I think that they're the first community sort of in the state of California to test absolutely every single resident. I do not know, but I actually am friends with Dennis Rodoni, who is the supervisor for Western Marin, and I can reach out to him and find out a little bit more about how that took place and when they anticipate those testing results. So I can definitely get back to you on that one, and I'll write that one down. Next question.
Somebody just wants to let you know they saw lots of Oregon license plates out at the beach.
A lot of what kind?
Oregon.
Oh, wow. Interesting. So someone just mentioned that they saw a lot of Oregon license plates out at the beach. I had heard that actually Highway 1 through Marin was completely packed. And so we definitely saw a lot of people coming up from San Francisco and taking the scenic route along Highway 1 and also from further in the Bay Area. As a reminder, about 95% of the contacts that have been made between our, parks representatives and members of the public who are trying to violate the shelter-in-place order at the coast have been out of county. So 95% are out of the county, and it's very interesting to know that unfortunately we have people coming from other states as well.
What is the phone number for people who need a hotel to isolate?
Oh, this is a great question. What is the phone number for people who need a hotel to isolate? I would call 211 actually, and they will be able to patch you into sort of that will probably go through the Department of Health Services, and they will make sure that you have space. That is one of the good things about our alternative care site, is that we do have opportunities if someone has been in close contact with a confirmed positive patient for them to actually go and self-isolate at this alternative care site. And if you read some of the national news that's been coming out, some of the cities and the communities that have struggled, where they've really seen the most spread, are in large households that are all under one roof. And so that's where it becomes really, really critical for us as government to step up and offer people an opportunity to self-isolate. It's really challenging to limit contact. Obviously, when you have multiple people sharing, especially one bedroom, or even one house that has multiple bedrooms. And we have had instances in Sonoma County where we have households of 12 where we've seen extensive spread through that household, and where we've also actually had as many as 20 people sort of exposed by one person, infections that were 20 to 1 ratio, which is pretty substantial. Next question.
Please explain the justification of paying $20,000 for permanent essential business travel along signs on Highway 1. I would have liked to see the city of Santa Rosa use funds to cut down the very high grass and weeds at my street access, etc.
Gotcha. So this question was about the amount of money that it costs to install the signs. And this is something that I actually supported because I actually believe that this is a fairly low cost. I know that it sounds insanely expensive, and $20,000 is a lot of money, but we are also actually paying, for instance, $10,000 per town hall just to share a virtual town hall with the community every week. The unfortunate thing is that trying to get the word out to people, trying to sort of notify mass numbers of people is extremely expensive. Our SoCo alerts contract is actually over $100,000 a year just to be able to issue alerts to people in case we need to during a disaster. I absolutely agree that we need to address your roadside mowing issues, but I do think it's really important that people coming from out of county know that we are a shelter-in-place county, and that if they are entering this county for tourism purposes, that is not legal. And unfortunately, we were getting a lot of folks out still on the beach, on the lower Russian River, and they claim ignorance. Well, guess what? When you've got flashing signs telling you the beaches are closed, and when you have these sort of other signs that are installed warning you that it's a shelter-in-place order, that sort of claim of ignorance does not fly. And so that actually allows our law enforcement partners to go ahead and take action, issue citations, and issue fines. And that's the only way that we're going to keep our communities safe, is if we get people, especially those out-of-towners, to actually follow the rules. So I respect that you didn't appreciate the signs, but I heard a fair amount of positive feedback from some of those really heavily tourism impacted towns. And that was actually really where the signs were needed, right? It wasn't necessarily for people driving around in their neighborhood in Santa Rosa, but more for those entrance and exit points to the county where we see a lot of those out of area tourists. But anyways, if you send me an email, I can definitely look into your street and see if we can get you some of that mowing and some of that fire risk reduction done.
Can you clarify the regulation on use of masks outdoors?
That's a great question. Can I clarify the regulation on the use of masks outdoors? So first of all, we're not calling them masks, right? Even though I always want to call them cloth masks, we're actually calling them facial coverings. A facial covering could be as simple as a bandana or a scarf, just tied around your face in a way that it covers your mouth and your nose, right? So it could be really, really simple. I mean, this, if I were to tie it around my face, that could count as a facial covering. You also have a lot of different organizations right now giving away some of these cloth facial coverings, more like a cloth mask style that can either go around your ears or be tied around your head for free, which is great. And if you need that, please let me know. Send me an email to linda.hopkins@sonoma-county.org, and I can try to pair you up with a cloth facial covering. In terms of when you need to wear them, you need to wear them whenever you're out and expecting to see other people. Even if you're able to social distance, if you see another person, you need to have a facial covering on. So this definitely means when you're going into the grocery store or to any kind of essential activity, for instance, going to a doctor's appointment, going to a hardware store to pick up, you need to fix something that went wrong in your house, plumbing problem, you need to go to the hardware store, you need to wear a facial covering. So anytime you enter a business, but also anytime you are, if and when parks become open, which we're excited, to be hearing about that on Tuesday, you will want to wear that facial covering when you're out on a trail, right, where you might see other people. That said, if you're walking down your street and there's absolutely nobody else there and you can't see anyone, you don't need to wear a facial covering. And what a lot of folks are doing is they'll just kind of wear their mask around their neck, and then they can pull it up if they see a person, and they can pull it back down and, enjoy the fresh air if they don't. So again, you can walk to your mailbox, at the end of your driveway if you live in a rural area, and not have to worry about being fined if you don't have a facial covering. But if you are going to go into a place where you expect to see other people, absolutely get that facial covering on. Next question.
A couple questions about parks. First one, what about people who can't safely walk or bike to any parks?
So this is a great question. And the question is, what about people who can't safely walk or bike to parks? And this is a really tough one, and one that I know I have lost sleep over. I know Bert Whitaker and Dr. Mace have lost sleep over it as well. We really want to reach a point where we have equitable access to recreation. And the sad fact is that a lot of our areas, including Western Santa Rosa, are underparked. They don't have nearly the concentration of parks that other parts of our community do. Furthermore, folks who have maybe mobility challenges or families with young children have a hard time walking or biking anywhere. And so, unfortunately, a soft opening of parks that only allows you to sort of walk or bike in is going to create equity issues. And the problem was that if we, the opinion of our public health officer, Dr. Mace, was that if we went further, that we could see the start to see the kind of crowding that could lead to the rapid spread of COVID-19. So we're going to take this in phases, and I really hope that this phase goes smoothly. We don't see a big increase in cases, and if that's the case, then we'll be able to relax even more and allow more access to parks. I do know that there was some consideration, and I haven't seen the final language of the public health order being given to, will we set up certain parking spaces for people with disability license plates or different things like that. So stay tuned. We will have more information for you on Tuesday at the Board of Supervisors meeting, where we expect to review both the revised shelter-in-place order as well as the revised parks order.
Okay, the follow-up from another person is, how are you going to enforce the new parks order? I'm concerned that well-meaning but overly suspicious neighbors taking policing into their own hands.
This is a great question, is how will we enforce the new parks order? And I think that it's going to be challenging because we're already seeing challenges, with respect to enforcing the beach closures on the coast. We're already seeing a lot of out-of-towners actually attempting to utilize Russian River beaches, parking in neighborhoods and things like that. In a couple instances, I have some support because we were able to just last week approve some no parking areas in the lower Russian River of places that have traditionally been impacted by out-of-area visitors coming and parking in rural residential neighborhoods where there isn't sufficient kind of access and you couldn't even get an emergency vehicle through if you had, people parked on both sides. So we will start to be able to put in no parking signs and then work with our law enforcement partners, including CHP, California Highway Patrol, to ticket folks. But I think this is going to be an all hands on deck enforcement between regional parks, state parks, the sheriff's office, as well as CHP to try to make sure that people aren't taking advantage of the health order. And, I think that we live in a very anxious time. And so some people are, kind of looking in the community for anything that anyone else is doing wrong. Others are worried that people are thinking they're doing something wrong even when they're not. And so, at the end of the day, let's try to take care of each other. Let's try to support each other. And if you know that there's a flagrant violation of the shelter-in-place order, let's leave that to law enforcement. Again, the sheriff's non-emergency phone number is 565-2121. It's pretty easy to remember. Share that with others and encourage them to utilize law enforcement and not take matters into their own hands.
Somebody said, what about real estate? I assume they mean with the new...
That's a good question. So the question was, what about real estate? And I assume that means with the new shelter-in-place order. There are also some slight relaxations on real estate in terms of, the ability to sort of actually visit a house in person if you are planning on purchasing that house. So I believe that there were some modifications from the initial shelter-in-place order to the shelter-in-place order that does open up a little bit more in terms of real estate transaction. If you're asking about my opinion on the real estate market, I am not an expert. And so we actually do have an expert coming to the Board of Supervisors on Tuesday. It is Professor Eiler from Sonoma State, who will be sharing an economic forecast. So some economic modeling for Sonoma County. And I actually requested after one of these Fireplace Chats, because someone asked about real estate, that they include modeling on the potential real estate market in Sonoma County as well. So he will be sharing his thoughts on real estate on Tuesday. Question.
Any progress on getting grocery, convenience store, food service, transportation workers priority on testing?
Okay, great question. So this question was, any progress on getting priority testing for grocery store workers and other essential infrastructure employees? Not yet, but we are really close. And I don't think that the press release has gone out, but I did find out, I think it was late news on Friday night, that we have successfully worked with the state to secure 2 additional testing locations for COVID-19 tests. And so we are hoping that once those come online, and I think that each one can test up to 130 tests per day. So we're looking at, more than 200 new tests 260 new tests per day, which is really, really good news. And so my hope is that once we have now the drive-through test operating up at Shanate with our public health lab, and then we bring on this new it's actually a company that the state is contracting with, and they have sites all around the state, and so it's kind of a partnership between state and local government. So we're actually going to get 2 in Sonoma County, which is really exciting because there aren't that many throughout the state. So hopefully once that comes online, we will be able to get to those essential infrastructure employees. And then our goal ultimately is to test anyone in the community who has any kind of a symptom that could be COVID-19. So that's the big goal, which would mean that we need to get to around 800 tests per day, we think, would give us the capacity to test all of those priorities. So thanks for asking that question. And I'm really hopeful that very soon, once we get those additional 2 sites stood up, that we'll be able to help out with our essential infrastructure employees.
Any idea when youth sports might be given the green light?
This is a great question. Any idea when youth sports might be given the green light? Honestly, I don't know. I have had conversations with Dr. Mace wherein she talked about, some ability to open up summer camps for kids over the summer, but they would likely have similar restrictions to what we are seeing in preschools right now, where you have a max number of children and we have to have the same children with the same care provider, for the duration of the camp. So stay tuned on that. I know that it's a top priority for a lot of parents and families, and it's definitely something that is on the radar of our public health officer as we look at, what the summer is going to look like.
How are we going to stop vacation rentals happening in the Russian River area through the summer?
This is a great question. How are we going to stop vacation rentals from operating through the summer in the lower Russian River in particular? And this one is where it's critical to report them, right? If you know someone is operating and they are continuing to list their property despite the shelter-in-place order, we need to call the sheriff's non-emergency hotline. And I actually have been meaning to send an email to the sheriff all day long, but I'm going to sort of sit down with him and have a conversation about what we can do on the county side of things to make sure he has the resources he needs to get this done. I know that the sheriff's department has never fully recovered from actually our last recession in terms of the number of deputies they have on the streets. And so, they took a really big budget hit during the recession back in 2007, and they've never really kind of gotten back to the level of staffing that they had pre-recession. So we need to make sure that he's got the resources he needs in order to address those vacation rentals. But it will take people being vigilant and reporting what they think are violations of the shelter-in-place order.
Kind of related, will we find people who break the rules? They will not follow them if you do not.
Well, the question is, will we find people who break the rules if they do not follow them? Absolutely. The public health order actually gives the authority to the local law enforcement agency to find people if needed. And I do think that's one of the reasons that I believed in posting signs and trying to educate people, because I think that people should have a warning first. But if you drive by a sign that says you're in a shelter-in-place county and you're coming and you are, just sort of having a great weekend and whatever, getting drunk and floating down the river, that is not acceptable, and it's creating a risk to public health. And so the sheriff absolutely does have the authority to fine and actually even, issue citations for folks. I think it maybe is a misdemeanor. I'd have to double check the language.
What about civil cases filed with the courts? When will they resume?
That is a great question. So the question is, what about civil cases with the courts? When will they resume? That is one that I do not know, and I can definitely follow up with our justice partners and check in with the presiding judges and the public health officer to see if there's any additional information on that.
The next question is, I saw HR posting for a public health officer. Is Dr. Mace leaving us? I hope not.
Oh, interesting. This question was, is there, that someone saw a posting for a public health officer. Is Dr. Mace leaving us? I hope not. I hope not too. I have talked to her. I think that she is in this for the long haul, and as challenging as her job is, I think that she is really thriving in it. I mean, she is out there, on the front lines with the nurses who are doing the tests, making sure that her team has everything that they need to try to step up the testing. And I know that we struggled early on to get adequate testing in Sonoma County, and we have still struggled to obtain the number of swabs that we'd like to see, right? We got the 5,000, get another 5,000 really soon, and we have a big order for 100,000 swabs. But honestly, what we've been able to do in Sonoma County under Dr. Mace's leadership is pretty amazing. There actually aren't very many counties in the state of California who is doing the level of asymptomatic testing of close contacts that Sonoma County is. So we are really trying to take a lead role in getting out there and going above and beyond what is standard. We've been lucky that she's been creative, and our Director of Health Services, Barbie Robinson, has been creative in terms of how do we get, additional PPE? How do we get additional tests? how do we get additional swabs? So, literally everything from stocking certain suppliers on Amazon to, ordering through import companies, working with different hospitals who, know somebody who imports things. We have really worked very hard to try to increase our testing capacity locally. And I give a lot of credit to Dr. Mace and to Director Robinson for the work that they have done.
It's hard to quite tell the way this is written, but can you help supply PPE to seniors at home who have something and take them on essential errands? Please help SoCo Council on Aging, essential workers.
Okay, great. It sounds like there's a request for potentially essential workers that relate to homebound seniors needing PPE. And absolutely, I can get that request into the Emergency Operations Center. We do have PPE both currently available and additional large orders coming in. So please send me an email to linda.hopkins@sonoma-county.org and I will try to meet your PPE needs. If it's for sort of critical healthcare workers, we can definitely help supply the PPE. If it's for just the seniors, then it would probably be facial coverings. And I am working on trying to secure, additional facial coverings for those who cannot afford facial coverings.
Gavin Newsom announced a senior meals program. How will we know what restaurants are participating in the West County? How can seniors learn about their options locally?
This is a great question. So this is referring to Governor Newsom's announcement of the sort of Meals on Wheels via restaurants for seniors during COVID-19. And I will be totally honest, we work great with the state. The state has been doing wonderful things, but this was one of those instances where, you're at work and your coworker is kind of doing your job and then telling you afterwards what's happening, and you're not, it's sort of like they went out and did something on their own, and then counties are kind of the ones who are supposed to be doing it. So we are still awaiting additional information from the governor's office. He kind of made it sound like the state was going to come in and stand up this program, but they don't really necessarily have the employees on a local level to do that. And the county's been working very hard to secure different food chains and, and go into contract with local nonprofits to provide food for people. So we were a little surprised by that announcement. It's a great idea though. And we actually were already planning on funding it in West County. So I can tell you that part of the tourism impact funds that went through the 5th District office and will go out to be voted on by the full board on Tuesday do include programs just like that. And so we actually have some money going to specifically the Lazy Bear Fund for the Lower Russian River, and we've got some money going to the Bodega Bay Chamber of Commerce, and we've got some money going to the Friends of Rio Neto for sort of a program affiliated with Rio Neto. And then also Russian River Alliance is doing a little bit of that work as well. So we have a number of different programs that we are funding independently, primarily centered around the Lower Russian River because that's where the applications came in from. But we are also working through the Emergency Operations Center with Food for Thought and Series and other organizations to try to get them additional capacity to feed locals. So stay tuned. I hopefully will learn more from the state about what their plan is and how they're going to sort of help us get that done. But I am really hoping that this will help some of our restaurants who are struggling right now to make ends meet, as well as some of our seniors who are fearful of going out to the grocery store. So I think the idea of delivering restaurant fresh meals to seniors is a fantastic one, and hopefully we'll learn more about it from Governor Newsom and his team.
Is there something special that can be done as a community for all the graduating seniors?
This is a great question. Is there something special that we can be doing as a community for all of our graduating seniors? I've had a few different proposals, and I'm trying to find ways to fund it. Unfortunately, we just sort of spent a whole bunch of money on trying to do, COVID-19 response to help our workers and our seniors and our unsheltered and our undocumented friends. All of those sort of programs are going out. And then someone said, hey, what about the seniors? What can we do for them? And so I know that Sebastopol is actually working on putting up sort of banners of all the graduating seniors downtown, and they asked if we could partner and actually do that in Guerneville and Forestville as well to honor those El Molino High School graduates. And I also had a request from some of the Western Santa Rosa high schools as well, so I'm trying to actively find some funding. But I think it would be so great if the downtowns of our community, even though we're not going there very often, would be lined with the faces of all the graduates so that they could have sort of a virtual graduation. The whole community could step up and honor them. So I also have seen actually some things around, I think, social media where people are just putting, signs of their kids in the front of the yard so that people can at least know that there's a graduating senior in that home. So, whatever people think. But I really like the idea of having the students, if they're comfortable with it, with their photos on banners in our downtowns. And I think that would be a nice way of honoring our graduating seniors.
In Santa Cruz, they allow visitors to parks by blocking every other parking spot. Is this something we might see at our parks?
This is a great question. So the question is, in Santa Cruz, they allow visitors to their parks by blocking every other parking spot. So it decreases the number of people who can come to the parks. Is this something that we would consider in the future? Absolutely. We are actually already having conversations about what could be, the next round of parks loosening if this one works out, right? So, it might involve something like, for instance, Mendocino, where they have a lot fewer people and a lot more space, are actually allowing people to drive within 20 miles of their residence to visit a nearby park. So, Santa Cruz is doing it by decreasing the density of their parking spaces and available parking lots. So we're looking at various models, but Dr. Mace and in consultation with Bert Whitaker, our regional parks director, really wanted to start slow just to make sure that we didn't go too far. Because what would be really awful, I think, is if we let everybody go, all over the parks, and then it really didn't work out and the park system was completely overwhelmed and we saw, significant outbreaks of COVID-19. And so the idea is to kind of phase back in all of the sort of different, liberties that we took for granted just 3 months ago, right? So, how can we sort of start small with parks? And then if that works out, we'll go a little bit further, right? And a little bit further until we kind of get back to the full use. I will also acknowledge that one of the other challenges with parks is that we know that bathrooms are not a great place to be if it's a public bathroom in the middle of a pandemic, right? Because you're in an enclosed space, very difficult to social distance, a lot of high touch surfaces. And so that could be a potential source of spread. So that gets a little tricky, right? When you have a whole bunch of people at a park and you have no restroom, you potentially have environmental impacts from people just, relieving themselves where they need to, when they need to. And so that's actually something, unfortunately, that we've seen in the lower Russian River and the coast, because there also aren't a lot of the normal bathrooms, available. People aren't using restaurants the way they used to. And so, so there are a lot of, it's more complicated than just sort of, okay, let's snap our fingers and use the parks again. There are all these kind of different levels of how do we creep back towards something that's normal. So just wanted to bring that up as one more thing you might not have thought of that we think about way too much in county government, public restrooms. Next question.
You kind of answered this, I think, but what power do authorities have to enforce the shelter-in-place directives? I'm an essential worker risking my health and have been disturbed by consistent out-of-state plates in front of our business.
This is a great question. So this sounds like another person who is concerned about shelter-in-place violations, and that this person is an essential employee but is seeing a lot of out-of-state license plates wherever it is that they work. Absolutely, please call your local law enforcement phone number. So non-emergency number, don't dial 911 because it's not an emergency, but do call the non-emergency law enforcement phone number. If it's sheriff, it's 565-2121. I don't have the SR number memorized, but if it's an incorporated area, just look it up for whatever incorporated city you're in, whether that's Sebastopol, Santa Rosa, or Petaluma. And they do actually have the authority to fine or issue citations to people. So this is not just a verbal warning, but it can get serious. And I think that if we start to see people who are very clearly intending to violate the shelter-in-place order, that I'm expecting that law enforcement will step up and really start to ramp up the response to that as well.
What's the number to call for people who work in hospital, in any job, to have access to testing? Is this antibody testing?
Great question. So I do have this number written down. The question is, what is the drive-through testing for healthcare workers phone number? And that is 565-4667. So again, 707-565-4667, and that's by appointment. And this is only for healthcare workers, but healthcare workers is a broad net. So you could be a nurse, you could be a physician, physician's assistant, clinician, or you could be just on staff as, a receptionist, or you could be someone who works security at that facility, or a housekeeper or a janitor. So it's anyone who is working in a medical facility can utilize that phone number. Again, 565-4667, and we will provide you with drive-through testing by appointment up at the public health lab. It's in the parking lot over at Shanit.
Someone just pointing out the DMV doesn't have plexiglass to help workers, just FYI.
Oh, interesting. So someone mentioned that the DMV does not yet have plexiglass to protect workers. This is something that I think that we really need to step up and lead on in terms of government. So I will definitely reach out to our local state representatives. I think it's critical that we make sure that employees are safe, as well as people who are coming to utilize these services. So we're actually having a lot of conversations internally at the county about how can we implement this best practices, because I really feel like, if county government is the one who's issuing public health orders, then we better be, leading the charge on compliance and going above and beyond to make sure that people who are using government services, as well as our government employees, are safe. All right. And on that, thank you all so much for joining. I hope that you are staying safe and being well. If you have any other questions, please email me, linda.hopkins@sonoma-county.org. I'm always happy to respond, and take care of yourself. I know it's a bit of a crazy time, but we've got the mental health warm line. Just send a text to a friend. Send a letter to someone that you haven't in a while. One of the things that I am always inspired by is the extent to which Sonoma County steps up when the going gets tough. And what I am seeing in the community with people staying home and sewing masks, people donating their dollars, donating their stimulus checks, donating food, volunteering if they can to deliver food. It's wonderful. We have amazing folks, and that is how we are going to get through this. And if you can, don't forget to support your small businesses, right? So if you can, afford to go get takeout at a local restaurant, go get takeout at a local restaurant. If not, we've got a lot of local great grocery stores. And if you need food, don't be afraid to ask for it. I want to make sure that nobody is hungry. So go to socoemergency.org and you can click through and find all of the resources for food. We've got food drop-offs all over the county, so please don't go to bed hungry. Take care and be well.